Hey, this is Matt Urtz, the Madison County historian. We are still working to document how the ongoing COVID-19 pandemic has impacted Madison County. And today we are talking to Beth Kelly, who is a registered nurse and the clinical coordinator for the Mary Rose Clinic. Thank you for joining us, Beth.
Thank you.
So for those that aren't familiar, can you tell us what is the Mary Rose Clinic?
Mary Rose Clinic is a free clinic for the uninsured or underinsured. We also take in patients that need like a physical for a job or something like that.
Okay. Where is it located?
We are in the 1081 North Side Shopping Center in the Gorman Foundation Community Center.
Okay, thank you. When did you guys start to hear about the COVID-19 pandemic and maybe start to prepare for it?
Early March.
Okay. What did those preparations kind of entail?
Well, we decided what we wanted to do with the clinic since we really don't have a lot of PPE and isolation in the clinic. We weren't comfortable bringing in any like sick patients. So we really couldn't accommodate that based on, we don't have isolation rooms and whatever.
Okay.
So we decided that we were going, after much thought with Dr. Martin, who's our director, that we would start with just taking phone calls, and on our days that we would normally have our clinic, we would be there to do some teleconferencing and that kind of stuff with our patients.
Okay. So once you kind of start that process, did you guys adapt on the fly as people had different situations arise, or did you kind of stick to that up through the current time?
We kind of still are doing that. So what we did, we set up the phone so I could answer it from my home. So I answered all the phone calls during that time, decided by screening the patients if they, needed a conference call or if we could do the Zoom or the telemed with them. And that's how we worked that out with the patients.
Have you seen an uptick in calls or kind of consistent or less calls?
Well, I have my stats. Starting in April, we worked with 101 patients. During that time, 19 of them were telemed patients. So they were actual visual with Dr. Martin.
Okay. Just so folks that aren't familiar, talk a little bit. Telemed is basically kind of what we're doing now, where you can call in or talk to a doctor on a computer.
Correct.
And how does that work, without getting into specific circumstances, how does that work for the doctor? Because that's got to be somewhat more difficult because you're not seeing a patient in person.
Right. You're not examining them physically. However, you would talk to them and ask them what their symptoms are. And, based on that, she assessed on what the patient would need. Okay.
Are you still allowed to prescribe medicine or anything like that through that kind of?
She would do that, yes.
Okay. Did you have situations where you were dealing with folks that thought they might have COVID?
We had a couple, yes.
Okay. Talk a little bit about how you guys feel like this might impact you moving forward.
Okay. Well, we recently reopened. We were closed for 12 weeks.
Okay.
And starting on June 3rd, we reopened with a new format, which involved appointments only. Originally, we were walk-in. However, now the patients call and I do a pre-screening based on all the CDC recommendations before any patient can come in. And we're limited on how many we have, and everyone needs to wear a face mask.
Has that slowed down the process, or have you found that once you opened, you had a lot of people coming in that had questions?
It's really worked out actually very well. So whenever they'd call, if it was something they needed to be seen for, we'd bring them in, pre-screen. It's really efficient with them coming in at the time. They're the only patient in there. They're seen and sent away. So there's like no mixture of patients.
And what's the process in between? Do you have to sterilize each time after they leave then?
Yeah, just standard, like we do in the hospital, just cleaning the rooms, like all the standard cleaning CDC recommendations. Yes.
Have you guys seen an uptick in patient needs since this all started, or has it been reasonably consistent?
It's been pretty consistent. We're a primary care for many patients. So the biggest thing we had were a lot of phone calls for prescription refills, blood pressure medicine, diabetic medication like that. So that's really been a lot of what we've been doing. And we did bring in a couple patients when we were closed that needed surgery and needed pre-op clearance, which they were screened prior, and we did bring them in.
Okay. I just lost my train of thought. Excuse me. Do you feel like as this goes on, this is going to forever change how you guys administer medicine, or do you feel like it might go back to normal eventually?
Well, I think this is our new normal, and with having the appointments, we really, really like that, because before it was just come on in, and sometimes patients would have to sit for a while if we were busy, and this has just worked out very well for the patients and for us.
Is there a way that patients do they have to call in, or do you have an online setup or anything like that?
Right now it's calling, because I have to screen them for the the COVID pre-screening. So, and then I just, tell them, what times we have available, and we have it online. So the clinic manager and I both know what patients are coming in.
Okay. Have you had any problems with patients not wanting to wear masks? That's become more of an issue in the last few weeks.
Not at all.
Okay. Is there anything else you'd like to say to folks about the Mary Rose Clinic and what's going on?
I just want to tell you the stats of the patients that we helped. So in April, even though we were not physically open, we helped 101 patients. In May, we helped 127 patients. And so far through June, we've seen 48 patients. So it's very gratifying to work there.
Just for my understanding, when you see less patients, is that because it's summer and illnesses tend to be down, or you just saw less patients as of the report right now in June?
We're just scheduling 6 to 8 patients each day. So that's going to be like our new normal, unless, somebody really needs to be seen for a physical for work, which we always want to help with.
Are you still doing the telemedicine?
Yes.
Okay.
So that would be for anybody that has any kind of a respiratory illness, because we are not seeing anyone that has that physically.
Is there anything else that is telemedicine based right now, or not really?
Not really, unless it's, something simple that they just want to, talk about and, don't need to come in for. But basically those are just phone calls.
Right. Were you doing telemedicine before COVID?
No, we weren't.
Is that something that's going to be around? It sounds like by every other doctor we've talked to, that's going to be around from here on out.
I believe so, until, there's a vaccine from COVID, I believe.
Well, a lot of doctors have actually said they think it'll be hereafter, because there's certain things, especially, and again, we talked to I think the Madison County administrator referenced that for our mental health services, sometimes it's actually significantly cheaper for the person to not have to get a taxi or a cab or,
Yes.
And telemedicine can, if it's something that can be done in that way, that the telemedicine actually makes it a little more cost effective.
Yeah. See, we're not really involved with that cost effect of it, but
Right.
I could, definitely see some of the things that we would, could do on the telemedicine or just by phone rather than, physical presence. But we are a primary care for many patients that are diabetic and hypertensive, so we have to physically monitor those people.
Right. Well, Beth, anything else you'd like to say?
Yes, I would like to give kudos to the Budman company out of Syracuse. I was having trouble getting face shields for our clinic, and I reached out to them. I asked them if I could order from them, and they said sure, and they actually hand delivered them to my home.
Wow.
Yeah, and it was great.
Anything else?
Initially, when we closed, I supplied Madison County with all of our PPE because they needed it for home care, and they replenished it once we reopened.
That's awesome.
Yes. So.
Thank you for taking the time to talk to us. If folks, just one more time for folks that aren't familiar, the Mary Rose Clinic is open to anybody that doesn't have health insurance.
Correct.
Is there any other things that can qualify for it?
If they don't have a primary physician, we also try and help every person that comes in to get insurance. We have an insurance navigator that works with us, and she's amazing on how she can help patients get insurance. We're really big on doing pre-physicals for work. We have a lot of patients that come in for physicals because they're getting a job, which we really, want to help everyone that can get a job. So really, it's a great place to work.
Thank you for taking the time to do this. I know you're very, very busy. I greatly appreciate it. And
Sure.
keep up the good work.
Okay. Thank you so much, Matt.
Yep.
You take
Bye now.
Bye-bye.